I'm here with my colleagues, Councilmember Sayles, who's lead for disparities. You'll hear from here momentarily, and Councilmember Albornoz, the chair of our Health and Human Services Committee. Hello, how are you? To celebrate the theme this year, and every year, is this about the mental health journey, and we're happy everyone else is here to celebrate too. So, couple things. Since 2008, we've been celebrating National Minority Mental Health Month. It highlights the really urgent need that was made even more urgent throughout the pandemic to support the mental health of our BIPOC, LGBTQIA plus community, and all ethnically diverse communities. By commemorating National Minority Health Month, we hope to normalize, streamline conversations around mental health issues for these communities, which have been historically an issue, and encourage people who are suffering to seek the help that they need. I'll be very honest that I had this stigma growing up, that you didn't talk to people about your problems, that it showed a sign of weakness, and that's been a lifelong journey of trying to overcome that. There's an obvious need to support the care of all members of our community, but by funding these mental health resources, expanding our mobile crisis outreach teams, increasing the numbers of psychologists and counselors in schools, we're trying to take a well-rounded approach to make sure all of our residents live healthy, happy, and fulfilling lives. I'm happy to be joined by my colleagues, Councilmember Albornoz, who chairs the Health and Human Services Committee and has been a stalwart champion of this work, and Councilmember Sayles, our council's lead for disparities in public health, who you'll hear from shortly, and the wonderful folks who are behind us, who I'm going to hand the mic to and ask them just to introduce themselves. Then at the end, we will hear very briefly, just 1 minute each, from each of the members of our awesome initiatives, the Asian American Health Initiative, the Latino Health Initiative, and the African American Health Program. So if it's okay with colleagues, I'll have folks introduce themselves, and then we'll hear from first Councilmember Sayles, then Councilmember Albornoz, and then we'll read the proclamation.
Good morning. My name is Kimberly Fogg. My organization is Global Sustainable Partnerships, and I absolutely love the Black Physicians in Healthcare Network. I love being their community partner.
Hi, my name is London Burton, and I'm with the Summarize internship.
Hi, my name is Brian Ringiefeld. I'm also with the Summarize internship.
Good morning. My name is Carol-Ann Trotman with Relationship Boosters, and I'm also part of the BPHN Outreach Network.
Hello, good morning. My name is Robin Little, and I'm the Program Director for the Black Physicians in Healthcare Network.
Good morning, everyone. I'm Carmela George. I'm with the Local Behavioral Health Authority, DHHS.
Good morning, everyone. I'm Arnisha Moody. I'm the Senior Administrator for Treatment Services for Behavioral Health and Crisis Services under DHHS.
Good morning, everyone. Nina Ashford, Chief of Public Health Services, DHHS.
Good morning, Dr. Keisha Davis, your County Health Officer.
Good morning, Nicole Lucas, is Director of Programs from NAMI Montgomery County.
Good morning, Karishma Sheth, Chief Program Officer at EveryMind.
Good morning, Ann Mazer, CEO at EveryMind.
Good morning, my name is Bibi Wolf. I am representing CCI Health Services. I am Dr. Bruton's Executive Assistant.
Good morning. My name is Simone Dawson, and I am the Director of Community Programs at Mary Center.
Good morning. My name is Robin Spare. I'm the Director of Behavioral Health for CCI Health Services and a proud mental health provider.
Good morning. My name is Mariana Sarrani, and I'm the Manager for the Latino Health Initiative at HHS.
Good morning. My name is Candida Hines, and I'm the Mental Health Specialist for African American Health Program.
Good morning. I'm Jacqueline Williams. I'm the co-chair of the African American Health Programs Executive Committee.
Good morning. My name is Gail Copeland. I'm on the Executive Committee of the African American Health Program.
Good morning. My name is Dr. Ikenna Myers. I'm the Program Manager of the African American Health Program.
Hi, good morning. My name is Sanjana Gossam, and I am the Program Manager for the Asian American Health Initiative.
Good morning. My name is Abdulaziz Kamus, Senior Clinic Manager at MCC Medical Clinic.
Give all our healthcare providers a little round of applause. And now we'll hear from Councilmember Sayles and Councilmember Albornoz.
Thank you to my colleague, Councilmember Jawando, for coordinating and hosting this proclamation, this important proclamation. I'm honored to be standing here with my colleagues as a member of the Health and Human Services Committee and as the lead for eliminating disparities in public health. Mental health conditions do not discriminate based on color, gender, race, or identity. Systemic and historical barriers have impacted how communities of color have accessed mental health and how they have been impacted by mental health. Particularly during the COVID-19 pandemic, we have seen a significant spike in our diverse communities accessing mental health services. As the lead for eliminating disparities in public health, I'm keenly aware of the importance of reducing mental health stigma and providing more wraparound support services for our communities of color. We are so fortunate to have so many dedicated partners here in our community working at the local level, as exemplified by all the organizations and partners that have joined us this morning. Here in the county, as you've heard from so many of our stakeholders, we have an excellent variety of services to combat mental health crises, including our 24-hour crisis center, our mobile crisis teams, health and wellness centers at our schools, and excellent nonprofit partners in the county. Please know that you have an ally here in me, and I thank you again for being here to recognize this important month. Thank you.
Thank you all very much for being here once again to acknowledge this very important recognition. We know that this is an issue that is plaguing our BIPOC community and has been for quite some time. We also know that in a recent public health survey conducted by the Department of Health and Human Services, mental health was the #1 public health issue that was dictated by our constituents, especially our minority communities. We are fortunate in the county to have an incredible group of organizations, individuals, and a county government that is doing everything in its power to ensure that people are seen, that people are heard, that people are respected, that we provide the services that they need for them to be able to not just support themselves, but their entire families. And we have to acknowledge that words matter. At the national level, the rhetoric that we are seeing, especially during this presidential election cycle, as we did 4 years before, is of deep concern and significantly and disproportionately impacts our communities. This impacts not just their mental health, but their physical health as well. And it's the perfect negative storm because these communities are often stigmatized and have the fewest resources to be able to secure and sustain the help and support that they need. And so we play an important role to fill that gap. We must continue to fund the organizations that are behind us, advance policies that make sure people feel heard and seen, and meet people where they are. I'm proud to live in a county that understands that we are only as strong as the diverse community that we have here among us that bring us together. So thank you all for this important recognition. There is still much more work that needs to be done, but we as a community are committed to doing it. Thank you.
Thank you, Councilmember Albornoz and Councilmember Sayles. Now we'll hear briefly from each of our initiatives, starting with Candida Hines of the the African American Health Program, and then Sanjana from the Asian American Health Program, and then Mariana from the Latino Health Program, in that order.
Thank you. Thank you to the council members for having me here today to speak on National Minority Mental Health Month. This month, we recognize the unique mental health challenges faced by minority groups and reaffirm our commitment to providing the support and resources that they need. Here in Montgomery County, I stand here representing the African American Health Program, which stands as a beacon of hope and progress. The AHP provides a wide range of services aimed at improving the health and well-being of our minority populations. Just to highlight a few, our maternal and infant health allows us to provide education, counseling, support, groups, and case management to expectant mothers. Our diabetes and heart health program, we conduct free classes and health screenings to help prevent and manage diabetes and heart disease. We also provide free and confidential HIV testing, cancer prevention and education, and oral health and many more programs. From counseling and support groups, educational workshops, and community outreach, the AAHP is dedicated to ensuring that every individual has access to the care and support they need. There's also a strong emphasis on mental health. And as the mental health specialist, I have been honored with the task of breaking down the stigma surrounding mental health, providing culturally competent care, and creating a safe space for individuals to seek and help and support through brief counseling and group therapy, all for free. Mental health is an integral part of our overall health, and addressing the mental health needs of our minority communities is crucial. So as we continue to promote mental health awareness and provide essential services, let us all remember the importance of community understanding and compassion. Thank you.
Hi, good morning, everyone. As shared, my name is Sanjana Qasim, and I'm the Program Manager for the Asian American Health Initiative, one of the 3 minority health initiatives in the Montgomery County Department of Health and Human Services. I'd first like to express my heartfelt thanks to the County Council for extending this invitation to join today's proclamation event. Mental health is an issue that disproportionately impacts the Asian American community, and it is incredibly important to continue to raise awareness about this. So many segments of the AAPI community are impacted by mental health. According to the Centers for Disease Control and Prevention, suicide has been a leading cause of death for AAPIs aged 15 to 24 for many years. In addition, AAPI older adults are battling with an epidemic of loneliness and social isolation, which is exacerbated when you add in other issues like limited transportation, limited English proficiency, lack of access to services. And then you have AAPI adults who are most often part of the sandwich generation, where they're battling with taking care of the generation above them and below them, and then with that, dealing with burnout and stress from their role as caregivers, leaving little to no room to take care for their own needs. Collectively, this is translated to a community with significant needs and little resources. AAPIs, while struggling with mental health, also struggle with utilizing the services they need to address their health. AAPIs have some of the lowest mental health utilization rates, with 60% less likely to receive mental health services than their non-Hispanic white counterparts. Those low utilization rates are due to a number of factors: lack of culturally responsive services, lack of access to services, stigma, and the lack of normalization of just mental health in the AAPI community. So as we celebrate this Minority Health Month, I'd like to use this as an opportunity to underline my community's needs for culturally responsive services, as well as the need in all minority communities. Montgomery County, as we all know, has a wonderful array of services, and our program works hard to bring these services to our community with the Asian American Health Initiative's mental health program, in combination with some of our other programs like our Healthy Communities Fund, where we are funding services in behavioral and mental health for AAPI communities that are tailored to their specific communities, have done a lot to cover the strides that are needed in the community. However, there's still more work that needs to be done. So I certainly, while we are here to celebrate the wonderful accomplishments that we have done as a county, would love to also use this as an opportunity to remind us and underline the needs to continue to work hard to bring culturally responsive services to all of our communities. Thank you.
Good morning. Thank you. Good morning. My name is Mariana Serrani. I am the manager for the Latino Health Initiative. So we would like to express our gratitude to Councilmember Jawando, Albornoz, and Sayles in honor of today's proclamation. The Latino Health Initiative mission is to improve the health and quality of the Latinos living in the county by offering programs and connecting Latino residents with health and human services that are cultural and linguistically proficient. This year's themes, Be Sure, Be a Source of Better Health, improving the health outcomes through culture, communities, and connection, calls on each of us to better understand how the unique environment, cultures, history, and circumstances of racial and ethnic minority population impact their mental health. In 2022, among adults with mental health illness, 40% were Hispanic, 38% were Black, and 36% were Asian. And they were 56% less likely than white adults to receive mental health services. LHI recognized the importance of engaging and enhancing public awareness of the unique strengths and mental health challenges that underreached communities face and promote effective strategies to eradicate stigma, break down barriers, and ensure equitable access to cultural response mental health services. In honor of this proclamation, the Latino Health Initiative recommits its efforts to continue working towards breaking the stigma of mental health by promoting open dialogue, challenging stereotypes, and raising awareness and education about mental health. We will continue working with our partners in our fantastic program that is called Community Mental Health Groups to foster sense of belonging and solidarity where individuals can share and process the experiences, seeking both formal and informal support, and find comfort in sharing histories, cultural values, and traditions among others Latino residents in the county. With the support of the County Council and the County Executive, we will continue our dedication to advance access to cultural proficient mental health services and resources to the most vulnerable residents in the county. Thank you.
All right, so we're going to read the proclamation now, and I'll start and we'll rotate here. Whereas National Minority Mental Health Awareness Month has been observed in July for 16 years to bring awareness to the specific and unique barriers to mental health faced by racial and ethnic minority communities in the United States. Commemorating the work of author and activist B.B. Moore Campbell, this month has been recognized since former Maryland Congressman Representative Albert Wynn introduced the effort in 2008. And
whereas mental health impacts our thoughts and feelings and is connected to our emotional, psychological, and social well-being. Mental illness can range from mild to severe, can be short-term or chronic, and can change at any point. As with physical health, mental health influences every aspect of life and can have serious implications when illnesses go untreated.
And whereas cultural stigmas, structural and institutional racism, socioeconomic factors, and lack of health insurance all contribute to the disparities in mental health outcomes for racial and ethnic minority communities. Historical practices of segregation and negligence still harm our residents, as demonstrated by the African American Health Program's 2019 Health Disparity Hotspot Identification Initiative, which created a map of the disparities in severity and treatment of mental illness based on zip codes in Montgomery County. And
whereas the National Alliance on Mental Illness reports that Black adults are 20% more likely to report serious psychological distress, and Hispanic American adults are half as likely to receive mental health treatment than their white counterparts. Devastatingly, suicide rates are increasing fastest among Black youth more than any other racial or ethnic group. And
whereas all BIPOC communities deserve justice in the form of better access to health care, reduced risk factors, and improved outcomes for their mental health. In Montgomery County, many dedicated individuals are working to address and eradicate the contributors to mental illness and barriers to care experienced by BIPOC communities. Inclusive and thoughtful community engagement is key to creating an equitable and anti-racist healthcare system that meets individuals' mental health needs.
now therefore be resolved that the County Council of Montgomery County, Maryland hereby celebrates National Minority Mental Health Awareness Month, and all officials, activists, and providers working to better support our diverse population. And be it further resolved that the County Council encourages all county residents to do the same. Presented on this 9th day of July in the year 2024, signed by Councilmember Jawando, Sayles, myself, and Council President Friedson.